It's a great honor and pleasure for me to participate in this webinar, and a big thanks to all of you for joining us this evening. Before I begin, I must make a confession. I am not a physician or some other medical professional. I don't represent any academic or medical institution, nor do I represent the government, whether it be federal or state. I'm simply a concerned citizen from Iowa who, until 6 years ago, served as an employee benefits consultant for employers during almost 3 decades. Since 1999, I have annually surveyed Iowa employers about the employee benefits they offer to their employees. As you might guess, health insurance is the big draw for both employers and the media. I use the survey results to help employers benchmark the competitiveness of their benefit packages. Additionally, this annual survey has goaded me to address one of the most frequent questions asked by employers and the media about escalating healthcare costs. Why is this happening? Now, I'm a visual person, so I developed an infographic that provides a relatively basic concept of the why question. It's called our healthcare river. Imagine a river that is polluted. It's easy, right? Pollutants enter the river upstream, and as the water travels downstream, we eventually pay the consequences. This slide depicts 2 key chemicals upstream: unhealthy lifestyles found in the upper right-hand side, and a fragmented delivery system found in the upper left-hand side. Downstream represents the pollution that all of us must confront when paying for health care, such as the insurance components. This cost affects us as individuals, taxpayers, employers, employees, and in so many different ways. Under the fragmented delivery side on the upper left-hand portion, there are many toxic substances leaching into our healthcare river. Lack of accountability across providers, poor coordination of care, deficiencies in clinical information systems such as health records, misalignment of payment incentives to providers, little transparency in cost and medical outcomes, medical harm to patients, and at least 30% of all funds expended for healthcare are wasted. So tonight, the area I will be focusing on is medical errors, which cause harm to patients. And by the way, medical errors are often a result of other icons not even mentioned on this infographic, and I'm sure each of you could list a number of other causes that I have not. To the best of my knowledge, very few states have surveyed their residents to determine their experiences and perspectives about medical errors. However, in 2014, the Harvard School of Public Health did just that in Massachusetts. I was impressed with their survey instruments, so I asked Harvard for permission to use most, if not all, of this questionnaire to survey Iowans. Permission was granted, and I am very grateful to Harvard. For Iowa, performing this type of survey was a first of its kind. It's never been done. So to help underwrite the cost of this survey, I approached numerous state and local foundations on behalf of my newly established nonprofit organization, Heartland Health Research Institute. There appeared to be genuine interest about the necessity of such a survey, but in the end, no organization was willing to fund it, possibly because such work could adversely impact their business relationships with the Iowa provider community, but this is pure speculation on my part. After giving us a great deal of thought about how necessary this study would be for Iowa, I decided to underwrite the cost myself. With that said, there is no financial, political, personal, professional, or other bias inherent in performing this study. I simply felt it was the right thing to do. This survey serves as a mirror to the Iowa medical provider community, as it allows them to see how Iowans perceive and experience the care they provide. To gauge a common understanding of the term medical errors, all respondents in our survey were given a statement defining medical errors, the same definition that was used in the Massachusetts survey. Perceptions of errors can differ between patients and their providers. The patient conception of what constitutes medical errors and harm may differ from the provider's perspective. 39% of all Iowans surveyed were familiar with the term medical error as defined in the previous slide. And this is our key finding. Nearly 1/5 of Iowans age 18 and over experienced a preventable medical error in the past 5 years, whether in their own care or in the care of someone close to them where they were very familiar with the care they were receiving. This finding is most likely low as many errors go undetected, whether by the provider or the patient and family members. Massachusetts, by comparison, found that 23% of surveyed adults experienced medical errors in the past 5 years. Additionally, the National Patient Safety Foundation in 2017 found that 23% of Americans experienced a medical error in the past 5 years. So even though Iowa's results are a bit lower than nationally, it is still egregiously a high number. And actually, I have Massachusetts and the National Patient Safety Foundation studies to compare throughout this presentation just to kind of give you an idea of how Iowa is doing. I will throw in some of the results from Massachusetts and the national study. 90% of Iowans felt the medical error that they experienced was indeed preventable. Iowans report that when an error was discovered, 39% were informed of the error by the responsible medical provider. Now, some national studies suggest that physicians disclose medical errors to patients only 25 to 30% of the time. Massachusetts, as an example, their result was 30% that providers had informed the patient of the medical error. And in the National Patient Safety Foundation last year, that number was 32%. So Iowa's results are a bit higher compared to these other findings. About 62% of Iowans reported the error, primarily to the responsible medical staff or to the administration of where the error occurred. Massachusetts, again, was at 54%, and the National Patient Safety Foundation at 45%. So Iowans tend to be more likely to report errors than what we see nationally. 9 in 10 respondents who reported the error said they wanted to prevent the same error from happening to someone else, which is a similar finding with both the Massachusetts and National Patient Safety Foundation studies. Half said the major reason for reporting the error was out of personal necessity, helping patients and family members cope with the problems that result from the errors. Only a quarter of respondents wanted compensation for the harm caused by the error. Again, these responses are similar to Massachusetts and the national study. Those who chose not to report the medical error had many varied reasons. About 2/3 simply did not think it would do any good, perhaps due to cynicism or lack of trust that providers would appropriately act on the problem. The next two top reasons following that first one relate to, I believe, an educational opportunity for patients and family members when they are confronted by medical errors and harm. They just didn't think they could report an error on behalf of someone else, and they didn't know how to report the error. 60% of all medical errors in this survey occurred in hospitals, while 30% happened in a doctor's office or clinic. In Massachusetts, that number was 75% in a hospital, and in the national study just last year, it was 34%. So there seems to be a great amount of variation. Part of it could be due to the national study perhaps asking that question a little bit differently than what Massachusetts and Iowa did. 6 in 10 Iowans report that serious harm resulted from the medical error. Massachusetts also had that same finding, while almost 1/4 experienced minor health consequences. For the Iowa survey, we added the financial consequences question to our survey instrument to better understand how patients are affected financially due to medical harm. Almost one-third reported serious financial consequences, while another 28% indicated minor financial consequences. So not only do harmed patients pay additional medical claims to have the air fixed, but the medical error may also have impacted their ability to earn a living, such as being disabled and unable to work. The top error reported is mistakes made in testing, surgery, or treatment. 6 in 10 Iowans indicated that, followed closely by a misdiagnosis at 55%. The national study in 2017 found that misdiagnosis was the top mistake at 59%, and the second most common mistake was made during a test, surgery, or treatment at 46%. So actually that national study in Iowa, you would just flip-flop the two top common types of medical errors. Nearly every person will experience a diagnostic error in their lifetime, and this came from the Institute of Medicine back in 2015. And as we all know, diagnostic error is a critical problem that impacts any subsequent care given to the patient. Respondents were given a list of 19 causes of medical errors and were asked what they feel are the most important causes of medical errors in Iowa. And their responses were rated on a series of factors using a 4-point scale where 1 means not important and 4 means very important. Here are the 5 most important causes of medical errors as perceived by Iowans. The most important reason cited by Iowans is overworked medical staff. However, many of the perceived top causes of medical errors concern information flow. Mistakes happen when medical staff don't know about care received elsewhere, do not communicate as a team, are disorganized, and do not listen well. Much of this has to do with organizational problems and perhaps poor training. So for the most part, well-meaning professionals are trapped in a subpar organizational system. And on the side, I would just say as well that the design of our healthcare system, how it is structured, reimbursed, technologically supported, and led, really determines how people in it behave. To assess the perceived progress of avoiding medical errors, respondents were asked if they thought there were more or fewer medical errors than 5 years ago in Iowa. The results suggest that Iowans are rather unsure of any trends in medical mistakes, especially when we look at the next slide, which compares Iowans who used an Iowa hospital in the last 5 years to those who did not. On this slide, you'll notice the far left 2 bars, the blue and the red. The blue bar represents Iowans who had used hospitals in the last 5 years. 21% of those people indicated that there would be more medical mistakes now compared to 5 years ago, and compared to about 12% of those who have not actually used a hospital in the last 5 years. And this finding suggests that Iowans, once they had care in a hospital, are more inclined to believe that more errors are likely to happen. And this is really not the response we would like to see if progress is being made. And if progress is being made, it's very slow. 93% of all respondents at least somewhat agree the general public should have access to information about all types of medical errors. This slide and the following few slides actually are more about sharing this information with lawmakers in Iowa about how the public perceives medical errors and how important it is for these errors to be shared publicly into a state-based agency. And so a lot of it is more policy-driven. "95% of all respondents at least somewhat agree that Iowa hospitals should be required to report all medical errors to a state agency." And by the way, unlike other states, Iowa providers are not mandated to report medical errors to a state agency. Almost all respondents agree that all providers should tell patients if a medical error occurred. 57% of all respondents believe their personal doctor would tell them if a medical error occurred. However, when we look at this slide, and we're going to look again at the far to left bars, the blue bar and the red bar, respondents with a prior error experience are less likely to believe their doctor would tell them, and that's 40% versus 61%. So once Iowans have experienced medical errors, they tend to feel that it would be far more unlikely that their own personal providers would tell them that a medical error occurred. Over a quarter of all Iowans surveyed, about 26%, believe that medical errors are at least somewhat serious, with another 11% believing they are not too serious. But almost half believe that medical errors are not a problem in Iowa. And perhaps in this case, ignorance is bliss. Based on the definition of medical errors read to them, all Iowa respondents provided estimates about the prevalence of medical errors they believe may occur. Overall, about 41% of Iowans believe it is very likely or somewhat likely for medical errors to occur during treatment. From all respondents, about 82% believe at least half of medical errors can be prevented. Fewer than one-third of all Iowans seek safety and quality information provided by doctors or hospitals. This number seems to be low to me, although I've seen even lower numbers from different studies. But when you think about it, and certainly being a patient or a father of a patient, many times trying to seek and find quality data to help discern safety and quality information is very difficult. I know it is in Iowa, and I'm sure it is elsewhere around the country. From previous research, we know that hospitals whose patients report better experiences also have employees, hospital employees, with more positive perceptions of the patient safety culture within the hospital setting. With this in mind, Iowans were asked 2 questions about the patient safety culture of hospitals and clinics. These questions were not asked by the Harvard Survey Instrument for Massachusetts. 90% of Iowans said having patient safety culture information would be helpful when assessing safety and quality of healthcare. In short, Iowans want to know just how much the medical staff think of their own safety culture practices. And think of it this way: if medical staff themselves were tepid about using their own facility due to unsafe practices, why would patients want to use the same facility for their own care? So this information is extremely important, and that is why we wanted to ask that question of per Iowans. In this slide, we asked it just a little bit differently. Almost 9 in 10 Iowans feel that having staff perceptions of patient safety culture would be useful to make a decision about where to get care. We received excellent coverage by the media recently when the findings of this report were released on January 8th. It was on the cover of the Des Moines Register, Iowa's largest newspaper, and it made the cover of the opinion section of the Des Moines Register a week or so after, with excellent comments about how unacceptable it is to rely on polls like this one to estimate the extent of medical errors within our state. And 2 local Des Moines television stations also covered this story in addition to radio. Just yesterday, I actually had my op-ed published in the Des Moines Register discussing possible approaches to take on learning more about the prevalence of medical errors in Iowa in the future. And I suspect that there probably will be a response from the medical community on that, but that remains to be seen. This is a quote that I had in a white paper I wrote 2 years ago in 2016 when I wrote a white paper called Silently Harmed. We don't know in Iowa, or for any other state for that matter, just how many people are harmed due to medical mistakes in a hospital. whether they're seriously harmed or fatally harmed. And so what I did in Silently Harmed, I took national data and tried to re-engineer it back to Iowa's numbers. And from that, it was a real eye-opener about how many medical errors happen within our state. But the quote is, if we don't know the extent of the problem, how can we determine whether the improved delivery and payment systems will solve it? And that was primarily a big reason why I decided to pursue this study, is that instead of trying to come up with a question or an understanding of how many errors are occurring in Iowa, we wanted to go right to Iowans and ask them, tell us more about your experiences. So to summarize much of this, Iowans strongly feel that medical errors must not be hidden from the public and should be reported, both to the harmed patient and to an appropriate independent regulatory agency. And if we don't, as patients, demand safety of care, they won't supply it. The prevalence of medical errors in our country remains a hidden public health crisis, and this study clearly demonstrates that Iowa is not immune from this serious problem. Quality of health care will only improve when leadership, organizational culture, and patient engagement are fully aligned. And patients really do deserve truthful, timely, and transparent information relating to safe care. So what can be done? Going forward, in Iowa, as in all other states, we are, quite frankly, clueless about how prevalent medical errors and harm are for patients. Knowing more about these metrics will eventually help us better assess whether progress is being made to eliminate these errors. We do know that error reporting and analysis leads to improved care over time and ultimately saves lives. But short of giving the medical community a lifetime dosage of a truth serum to report these errors, we could possibly pursue a three-pronged approach to learn more. The first would be to implement a mandatory reporting system for providers. Now, many states have already done this, and I realize that even those states that have mandatory reporting requirements, the data strongly suggests that there's still a great deal of underreporting. So in order for Iowa to consider a mandatory reporting requirement for medical errors to a state-based agency, we really need to look at these other states and be very cognizant of best practices from those states, what's working, what's not, and to get a better understanding of making sure that we have the right carrots and the right sticks in place. The second idea or pronged approach would be to pursue the feasibility of a patient incident reporting system. This would serve as a central repository for patients to report medical errors. This system could also help educate patients and family on how to report harm. As indicated earlier, that seems to be an issue with many of the patients and why they don't report errors. The third approach would be to develop an ongoing random sampling survey of Iowa patients. And this can supplement both number 1 and 2 above. The surveys could be arranged through AHRQ's HCAPS module on medical errors, or possibly team up with health insurance companies that have statewide patient claims data, but we would need to work around the HIPAA issues when we would do that. But that's certainly an option. And I would like to give credit, by the way, to Lisa McGiffert, project director of the Safe Patient Project, for hatching the HCAPS idea with me as a logical way to survey patients about medical errors. And this approach would really need to be prodded by a state legislative action. And I realize that even those states who have mandatory reporting requirements, the results are less than satisfactory based on the numerous reports that I've read over the last few years. To summarize, this study is the first step taken in Iowa, but much more must now follow. I believe that when informed, public opinion will play a vital role in shaping how policymakers and other stakeholders respond. The next steps we take in Iowa and elsewhere will actually help define our ethical commitment to this public health crisis. So I leave you with this quote: A preventable medical error becomes egregiously intentional when nothing is done to prevent it from occurring in the future. Thank you so much for your time and interest in this extremely important topic.